Olá, hello, oi, buenas tardes, olá a todos. Meu nome é Marie Ferreira. Welcome to our third call of the series Entre Fronteras. This one is COVID-19 and the impacts of health of Black women and girls. I'm going to be giving some instructions about how to use interpretation in English, Spanish, and Portuguese. Olá a todos. Olá, na verdade, em português, olá a todas. Sejam muito bem-vindos à nossa chamada Covid-19 e os impactos na saúde de mulheres e meninas negras. Meu nome é Marie Ferreira, sou coordenadora de comunicações da Afro-Resistance e vou dar instruções sobre como usar a interpretação em português, inglês e espanhol. Olá a todas, bem-vindas a nossa chamada Covid-19 e os impactos na saúde das mulheres e niñas negras. Mi nombre es Marie Ferreira, soy coordinadora de comunicaciones de Afro-Resistencia y daré algunas instrucciones sobre cómo utilizar la interpretación en inglés, español y portugués. So first, if you're on your computer, the interpretation is available at the bottom of your screen. Please check the button in the format of a globe, click there and select the language. We have interpretation available in Spanish, English, and Portuguese. The picture about how you can use the interpretation is in the screen. I would also like to remind that Zoom and other conferencing technologies were created to move corporate priorities forward. So please be aware that there is this technology divide. And it also includes languages. Sometimes it keeps us from being able to communicate with each other, including with internet connection, right? So here in this call, we have speakers and interpreters from all over the Americas for different regions with different access to internet. And Afro-Resistance works to bridge these divides, to break barriers of language, of interpretation, of internet connection, but we cannot control other facts such as hurricane, electricity, and other external impacts on our calls. So we ask you to be patient and compassionate, and to be with us throughout this an hour and a half. Mm-hmm. And on your cell phone, if you're on your cell phone, the interpretation is available also to the 3 dots at the bottom of your screen. Please click there, the 3 dots, select more. Select language interpretation or language service, mute the original audio and press done, and then you'll be able to hear the interpretation. Agora em português. Se você está usando o seu computador, a interpretação está disponível na parte de baixo da sua tela. Por favor, selecione um botão no formato de um globo e depois selecione português. E aí você poderá ouvir a interpretação em português. Se você está no seu celular, o processo é bem parecido. Clique nos 3 pontos que estão na parte de baixo da sua tela, ou um botão chamado More, ou Mais. Selecione serviços de linguagem ou Language Interpretation, se o seu aplicativo estiver em inglês. Coloque o áudio original no mudo. Em inglês seria Mute Original Audio, ou mutar áudio original. Selecione português e pressione Done. E aí você poderá ouvir a interpretação. E por último, eu gostaria só de lembrar que Zoom e diferentes tecnologias de chamada por vídeo, por áudio, foram criadas para mover, né, prioridades de corporações, prioridades corporativas. Então é importante a gente lembrar que essa divisão tecnológica existe e que muitas vezes ela é acompanhada de linguagem, nos impede de nos comunicar e também inclui conexão à internet, principalmente quando a gente tem pessoas, né, conectadas, speakers, attendees, palestrantes, pessoas que estão se juntando à chamada e também tradutores de diferentes regiões das Américas com diferentes acessos à internet. E a Afro-Resistance trabalha para fazer essa ponte e passar, né, por essas divisões, mas a gente não consegue controlar fatores externos, como furacões, perda de eletricidade, falta de acesso à internet durante os nossos fóruns online. Então, a gente pede que você seja paciente e também compassive e esteja com a gente aí durante esse tempo dessa chamada. Agora eu vou passar para a Ana.
Obrigada, Marie. Bom, sim, boa tarde a todos, todas e todes. Só falando em português primeiro, né, por ser uma questão da língua materna, nosso português, como diz Lélia Gonzalez. Good afternoon, everyone. Just making a quick introduction in Portuguese because it's my mother tongue, and as Lélia Gonzalez says, we don't speak Portuguese, we speak Afroguese. That's a mix between the African language and the Portuguese. So thank you for joining us today. It's a pleasure to have all of you here. I would just say the same information about interpretation that Marie just shared in English and Portuguese. I'm gonna try to say in Spanish, so hang in there with me. So, si usted está en la computadora, verifique la interpretación en la opción en la parte inferior de la pantalla y seleccione español. Entonces, solo escuchará la interpretación. Seleccione un botón con forma de globo. Si está usando su teléfono celular, seleccione la opción más, que haga clic en los 3 puntos que está en tu pantalla también, en la parte inferior. Luego seleccione los servicios de interpretación. Seleccione el audio original, seleccione español y listo. Nosotros también vamos a poner las informaciones en el chat, en la parte ahí, para que ustedes también tengan por escrito. Thank you so much. I hope that people understand me in my Spanish. It's really an honor to be here. So I would like to say that one of our speakers, Ornella Santahan, she's feeling very sick today, so unfortunately she will not be here with us. She's a doctor living in Haiti. This would be such an important contribution to our panel, but we are moving forward. But I would like to say here, Ornella, we wish you a very good recovery. And I would like to introduce the panels of today. 2 amazing speakers, Dr. Tlaleng Mofokeng. She's the special rapporteur on the right of everyone to the enjoyment of the highest attainable standards of health. It's a really honor to have you here. This format, this event is really the idea to break the barriers, the symbolic and the real ones between the communities and the international human rights system. It's really an honor to have you here and to be part of our community today. And Ana Belic, my very good friend. Ana Belic is part of the movement Reconocido in Dominican Republic. So the way that this will go is I will open the floor for each speaker to have between 5 to 7 minutes to give overall about the situation, COVID, and the impacts on the health of Black women and girls. Then we would like to have questions. So we have some questions sent by video. And of course, please, if you have a question, send it to us on our Facebook page, as well as here on the Q&A session. And we're gonna have a conversation based on the questions. One thing that I also would like to ask folks is put it on the chat where you are Zoom in from. So it would be amazing to see which countries you are in, and that this is really like a global community. And it's very joyful to see so many countries, so many communities being represented in this conversation. So thank you so much. I would like to pass to Dr. Tlaleng to have between 5 to 7 minutes.
Good evening, good afternoon, good morning to all of you, and thank you so much for inviting me to share this important space with you. I'm in Johannesburg at the moment, so it's quite late at night, but I'm quite encouraged for this opportunity to share and learn from you all. It's only just been 2 months since I took over functions as the special rapporteur. So it's also a time for me to meet colleagues, to meet governments, to meet civil society organizations, and you know, groups of women such as yourselves. And it is a challenging time, you know, for all of us. But I suppose the silver lining is that we are all connecting in ways that we could never have before, and we are getting access and gaining space in spaces that we were traditionally excluded from. And just to share a little bit about myself, I am a medical doctor and I've been working in South Africa for 13 years. And my story is one of being a medical doctor that has merged with a human rights defender. And this activism was really a fight for my own survival as a Black woman who lives in South Africa, who grew up in an apartheid era where racial segregation and racial discrimination was legislated and was normalized, and it became part of the institutions and the structure. And to this day, you know, it's still the present day of South Africa. And so, having been a young child growing up in that environment, I know firsthand what it's like to grow up in a community where you have military and police presence all the time, you know, harassing you, you know, our playgrounds and our school grounds. It was normal to have military, you know, patrols and the like. And I remember, you know, at some point in primary school, we had a helicopter, you know, hovering over our primary school, and we're just wondering, like, what is this, you know? And I look back now with so much like shame, even, you know, to think that someone somewhere sat and thought these Black kids needed some toothpaste and some toothbrushes, and these things came, you know, dropped from the sky. And just that vision still gives me so much chills, you know, when I think about how the world views us as Black communities, as Indigenous peoples, and it's just, yeah, and that's how I think my activism started. It's from those memories and those visceral reactions, you know, that one still gets from growing up in that environment. And so later on, when I, you know, arrived at medical school, you know, all bright-eyed and excited, you know, to take on medical school, I was affirmed in that feeling that I had, that as a young Black woman, that space wasn't for me. You know, it wasn't designed for me to just walk in and have the audacity and the guts, you know, to just be in that space. And everything about how we were taught medicine, about how we were taught, you know, to speak to our patients, how we are taught about disease processes, was definitely not for people like me. It wasn't about our dignity. It wasn't about respect for our own autonomy. And so I was immediately at loggerheads with the very institutions, the very faculty, the very science, the very medicine that I had dreams of contributing to. And that contradiction and that constant battling was something that I was fighting every day, and sometimes to a point where we would start protests, you know, at medical school because of the issues of racial discrimination, but also the gender inequality that was quite clear. And so when I did qualify, I decided to focus on sexual and reproductive health as my area of focus. And I chose that area particularly because I knew that for many Black women like myself, it was still luck that we made it through primary school, that we made it out of the communities that we grew up in, and that we actually got a tertiary education and finished. And it was something that I was never comfortable with. The fact that even where I grew up, I wasn't the hardest working. I was certainly not the smartest, but there's a few miracles that happened along the way that got me where I was. And I knew that for many other people like me, they didn't have those miracles happen. They didn't have these earned privileges where, you know, our mothers who were married, but they were still single mothers, you know, even in their marriages, had to work, had to study further, you know, improve their education, still come home and take care of us, make sure that we can dream. I mean, the audacity to dream as a Black woman, as a Black child, is still something so foreign to so many of us. And so I decided that, you know, if I specialized and focused all my energy into making sure that the human rights of people around sexual and reproductive health was promoted and protected. And for some times, it's just about protecting the rights, right? And in some opportunities, it's about advancing and developing those rights. And in some instances, and most of my career, it has been about how, as a medical doctor, I can merge being a human rights defender, and how in my treatment, in my practice of medicine, that in itself should be an indication that I'm a human rights defender, and that my practice of medicine was affirming of people, but particularly women and young girls and Black women, because there isn't enough safe spaces for us. And I realized that for many of my patients, that 10, 20 minutes with me in the consultation room was the most safe they will ever feel in their life. And so I was quite aware that there were certain things that I needed to do in those few minutes with them that would either give them just some hope to make it another day, or give them courage to, you know, actually just look me in the eye and say, yes, I am abused, you know, or just say, how do I go about getting a driver's license, you know? And I had a lot of young people who used to come to the clinic, but they would never come inside to consult. They'd all wait for me by my car. And we'd have all of these discussions and talks, and that they had nothing to do with illness and disease. But because health systems are designed to manage disease and illness, these young people knew that even the actual physical structure was not a space for them to just come in and ask about relationships, about how to break up, about, you know, safer sex, and all of these things around career guidance. And because, again, our communities to this day are still very much neglected in terms of social support, social services, recreational, you know, options for young people. And so the clinic does end up being that space where young people, you know, hover around, because it isn't an area of activity in the community. Sometimes it's the only area where there's Wi-Fi, right? It may be the only area where there's electricity. And so for some people, the clinic space is more than just a place of illness and disease. And yet medicine only still views, especially Black people, and I use this word intentionally, Black bodies, right, as vectors of disease, as people who are devoid of autonomy, who still need some savior to come and inject some hope in them, and look down on our indigenous knowledge, look down on our own efforts, right, to uplift ourselves, and judge us, right, for being angry at the establishment, for being angry at the system. And we didn't create the system, right? And yet it's the very system now that still perpetuates these inequalities. And yet we are supposed to be respectable and present this, you know, well-mannered and well-spoken, you know, women figures that are not angry, you know. And so I've learned, even now in my I suppose I'm an elder youth. I'm not so young anymore, but I'm not old. So I'm an elder youth of sorts. You know, I don't aspire for respectability. I don't aspire to be liked by everybody. I think it's impossible, especially when I'm someone who is anti-discrimination, anti-criminalization, and many of the people who are Black women find ourselves in vulnerable situations. We find ourselves further marginalized, either by legal framework or by policies or by the types of services that are inaccessible or accessible to us, and how some of these structural and oppressive systems continue to lead us to having negative health outcomes. And so in my role now as a special rapporteur, I hope to be intentional about recentering the margins and restoring dignity, because the aspiration of restoring dignity, you know, affirms the individual, because I can't describe to you what dignity is and feels like for you. So it demands of me to ask people, how would you like me to help you? Because I don't know what dignity looks like for you. And that's my vision, and that's what I center my work around. It's about listening, it's about learning, and it's not about centering myself. It's about recentering everybody else whose voice hasn't been heard, but it will be heard because I now occupy a seat at the table. And through me, we can demand for our rights, we can demand for respect, we can demand for bodily autonomy, we can demand all of these things that we know we need to make us thrive and not just survive, especially as Black women. And so with COVID-19, We know we could have predicted this. We told this, to people for free months ago that the fallout and the negative impact from COVID-19 will be disproportionately impacting Black communities, Black women, children, right? And again, people, if you think about Black women with disabilities, if you think about Black women with existing medical problems, Black women who have insecure jobs, Black women who are already dealing with chronic illness and disease, Black women who don't have leave at work, right? They're in jobs that don't even allow them those basic labor protections. And so with COVID-19, it's just really a horrific moment of crisis, but it further disenfranchises, it further marginalizes those very people who were already living in an unequal society. So our normal as Black women is already unequal. Our normal is already a crisis situation. So for me, it's just, sometimes I actually avoid thinking about how people are surviving COVID-19, because it's just, it's absolutely, it's chilling. It's bad. And so, yeah, today I'm just here to listen mostly, and of course to share where I can, and I'll stop here. But that's just, me, who I am, and what I'm about. Thank you.
Thank you, Doctor. I'm listening to you about the helicopters, and for me, it's fascinating how we have the same situation in Brazil too. How we do have helicopters shooting down on people, on many communities, and how the times that I tell folks here in the US, a lot of the times I will have people saying, but why? It's like, first, there is no reason, but do you think that there is a reason to be shooting people from, like the lack of humanity is so profound. It's so profound that even when we say things like they shoot people from the helicopters, people will be like, but why? Like if there is a reason that is justifiable to this type of act. And I'm also listening to you talking about the clinics and how it's interesting that is also a social space in many of our countries. The clinic, you do go to talk, exactly as you mentioned, it's not necessarily about illness a lot of the times. At least like many clinics in Brazil, we do have like cafecitos and like some food that folks can come and have conversations about health as well. And this is one of the things that I really miss here as someone living in the US, because at first I start to looking like, okay, what we can do about health here. Do folks like gather around clinics? And people are like, no, we don't, we don't do that. And this was also very interesting to me to understand how the health systems also works in different places. So now I would like to pass to Ana. So Ana, you have between 5 to 10 minutes if you would like to. So thank you.
Muchísimas gracias por esta invitación. Me siento muy honrada de poder participar con ustedes en este diálogo tan a toda la vida de la humanidad, mujeres negras de la República Dominicana. He estado llevando con la comunidad del cual soy parte. Siempre es una comunidad que durante por un proceso.
Ana, perdón,
¿Sí?
solo un minuto. Es que no te escuchamos, creo.
Oh.
No, ¿verdad? Ok. Entonces, creo que hay un problema con el micrófono.
¿Me escuchan ahora? Okay.
Ahora sí.
Bueno, pues vuelvo entonces. Les decía que soy Ana María Delique, soy de República Dominicana y desde República Dominicana trabajando con Nadie me escucha. Déjenme ver, porque
Está cortado,
¿Cómo?
está bien cortado. Pero cuando,
Quizás.
parece que como cuando te acercas un poco, suena mejor.
Ok, pues lo voy a hacer bien cerquita. Tal vez es problema de mi conexión a internet también, que no es muy buena. Bueno, desde República Dominicana yo trabajo con la comunidad dominicana de ascendencia haitiana, de la cual hago parte. Una
Todavía no funciona. De repente, a ver, prueba apagando tu video. A ver si eso...
Oh, deja ver si puedo con el audífono también.
Sí, como how we had said before, para nuestros escuchas en Facebook, a veces la tecnología no funciona. Y eso
Sí.
es parte de la...
Eso es parte de la realidad. ¿Me escuchan ahora que apago el video?
Sí.
Ok. Dentro de mis experiencias con respecto al tema de salud, yo quería comentarles un poco una experiencia reciente que he estado teniendo con mujeres de comunidades batilleras en República Dominicana, que durante el año pasado, no me están escuchando.
No, creo que si usted puede como salir y volver es mejor, porque no me parece un problema de video, me parece que hay un problema con el micrófono.
Oh, ok, pues yo voy a salir y voy a volver a entrar entonces.
Gracias, Ana, perdón.
Por mientras, si hay algunas preguntas, if you have any questions, you can type them on the Facebook chat, or you can put them in the Q&A. And we have a question, and the question could be addressed by, I do not want to mispronounce your name, Latling. What is the action plan into the international decade for our community, the decade on African descent for our community worldwide to fight COVID-19? And that question is coming from DR Congo.
Thank you. So I think it's important, to remind all of us that we are trying to survive a pandemic still, right? So it's quite difficult, I think, to expect sort of this coordinated forward-looking and forward sort of movement and action like into the future, especially around COVID-19 related issues. I think many of us are just stuck in just trying to survive and make sure that ourselves don't lose our jobs and our livelihoods, and that our immediate families are also taken care of. And I think this is the question where leadership comes in, right? We have to demand good leaders that are accountable, that do what they say by when they say they will do them, right? Because that's an issue of integrity as well. And many of us are reeling, right, from the impact of bad leadership in general. And COVID-19 has shown that. It has shown us that we do not elect quality leaders, right? And you can tell I'm an activist. I'm always speaking about, quite political stuff, but it's important because our whole lives are political, from the choices we make about, our pregnancies, whether they are supportable or not, and, the decisions we make about our education. I was just thinking now, even when our national lockdown was announced in South Africa, the immediate question was, where will queer people go? Because for them, home is not a safe space. So if you're going to think about a post-COVID world, a vision for African people, for people of African descent, if we are going to think about a vision and some developmental agenda for all of us, we have to think of this vision that includes everybody. Because currently, and I know this for myself as someone who lives in South Africa, who has memories of fighting apartheid, when the racial inequality came, right, through a democracy and we can argue whether that was really freedom or not. But we're still dealing with a lot of gender oppression and inequality that's still structural, that still perpetuates in society on many levels. So I know that the vision of democracy that South Africa had, for example, this agenda for people of African descent, an agenda for Black people in South Africa, still left many of us out, still left many of us behind. And so even as we think, and I know that within the United Nations structures, everyone is familiar with that slogan, leave no one behind. And it's about how we are all intentional in doing that. And the only way to be intentional is to ask ourselves, why have others been left behind all along? So that we can deal with the structural problems, right, of Afrophobia, xenophobia, sexism, racism, ableism, right, transphobia, homophobia, because those are the things that in many societies you can't put your finger on it, right? But it sets the tone. It others. It makes it easy. It normalizes rape culture, right? It normalizes violence against Black lesbian women. It normalizes violence against young girls who are just trying to get sexual and reproductive health rights realized in their clinic or get services. So an agenda for all of us post-COVID as Black populations, as Indigenous populations, as people of color communities have to be inclusive. Otherwise, we are just going to replicate these hierarchies, right, that don't actually deal with power structures. And we will leave more people behind. So I think this is at the moment, sorry, I don't have a good answer. I don't have a refined answer, but I'm just saying that we need to think much more intentionally than we have ever before about the different intersections, about the different vulnerabilities, and then make sure that on the table, it's young people, it's voices of people who are living with disabilities, it's voices of all these people who we know have historically never had a place on the table, like Black women. We only brought to the table when it's time for crisis to fix something, right? And when things don't get fixed, they blame it on us because we are angry and Black and loud. So there's a different way of thinking altogether that's required. And sometimes rearranging the entire table perhaps is what's needed, as opposed to just having more of us on a table that's badly designed. Maybe we need to just pause and redesign and relook at this very table that we are fighting for a seat over. So I'll stop here, but I do think we do have a moment to start thinking about what this means, when we really mean a future for all of us.
Yes, absolutely. If we don't talk about resources, we are not talking about real revolution here. So Anna, let's pass to you again.
Sí, bueno, vamos a ver si me escuchan mejor ahora, me dejan saber.
Sí.
Ok, pues
Por ahora,
perfecto.
súper.
Sí, bueno, como les decía, soy de República Dominicana y desde acá trabajo con la comunidad dominicana de ascendencia haitiana y la comunidad migrante haitiana. Con esta comunidad, bueno, históricamente ha habido un problema muy serio con respecto al tema de discriminación racial que han heredado o que hemos heredado los descendientes de inmigrantes haitianos en la República Dominicana. Con este tema del COVID-19 y la realidad de la salud a nivel mundial y de manera particular en la República Dominicana, vemos cómo todos los problemas que el sector salud ha venido teniendo se ha ido agudizando cada día más de cara a esta realidad de manera particular. Hasta ahora, por ejemplo, no podemos decir que la pandemia o el COVID ha afectado más las comunidades más pobres porque no ha habido un estudio que pueda reflejar dicha realidad. Además de que la población en los sectores más vulnerables no tienen acceso a las pruebas que puedan permitir diagnosticar qué tantas personas hay con dicha realidad del COVID. Yo trabajo en varias comunidades y me he encontrado con varios compañeros y compañeras que han tenido diferentes síntomas de lo que ha sido la enfermedad del COVID. Sin embargo, no tienen forma de comprobar si es una gripe común, si es otro tipo de gripe, porque sencillamente no tienen acceso a las pruebas PCR ni a las pruebas rápidas, porque viven en comunidades muy pobres, muy marginadas, que no son tomadas en cuenta muchas veces dentro de estos procesos de programas sociales. Desde que comenzó la pandemia, una de las cosas que nosotros hemos denunciado mucho ha sido todo el tema de las políticas de asistencia social que se implementó, que implementó el gobierno dominicano para proveer de ayuda a la población. Sin embargo, este programa de ayuda no llegó a las comunidades necesariamente más vulnerables con la categoría de ser dominicanos de ascendencia haitiana o migrantes, que en este caso serían los bateyes. Muchas de las personas de los bateyes no tienen documentación por la misma política de desnacionalización que ha venido implementando el Estado Dominicano en los últimos 10 años. Lo que hace que no solo queden fuera de las políticas sociales de asistencia social, sino también que están fuera de ser ciudadanos y ciudadanas con pleno derecho a exigir y a recibir los beneficios del Estado Dominicano. Todas estas políticas se han dado dentro de un marco de discriminación estructural que existe en la República Dominicana y que impide que como comunidad negra podamos disfrutar de pleno derecho de todos los servicios que ofrece la sociedad. El año pasado yo comencé un proceso con un grupo de mujeres, una iniciativa que se llama Muñecas Negras RD. Y uno de los objetivos de la iniciativa es generar un espacio de conversación y reflexión entre las mujeres. Motivado, claro, por todo el tema del aprendizaje, pero uno de los objetivos centrales de la iniciativa es hablar sobre nuestra identidad, sobre nuestra negritud y cómo nosotros podemos reforzar esto que la sociedad en la que vivimos nos ha enseñado a que es malo, es negativo y es feo, que es nuestro color de piel. Y dentro de la iniciativa, como nosotros realizamos diálogos todos los sábados o cuando nos juntamos, una de las cosas fundamentales es generar un espacio para hablar, para conversar sobre nuestras vidas, sobre cómo nos sentimos, sobre lo que está sucediendo. Yo recuerdo que uno de los diálogos es que hablamos de discriminación racial. Básicamente todas las anécdotas de las compañeras que estaban allí se basaron en todo cuestión de la violencia obstétrica que ellas sufren por ser mujeres negras que asisten a hospitales, especialmente cuando van a los hospitales embarazadas o cuando van a chequeo ginecológico. El hecho de ser negra y proveer de un batey ya de por sí se constituyen elementos que las personas toman para discriminarte o para maltratarte. Entonces, en aquel diálogo, nosotras durante toda la tarde estuvimos reflexionando y las mismas compañeras venían reflexionando cómo los doctores y enfermeros les trataban a ellas por ser negras o por tener un apellido raro que parece haitiano o por provenir de un batey. Para mí fue muy interesante esta experiencia y la quise traer a colación en este espacio, ya que estamos hablando de mujeres negras en este marco de COVID, aunque esto que le comparto va más allá de la realidad del COVID, pero es una realidad que nosotros vivimos a diario como mujeres negras, en donde la ética profesional de muchos doctores muchas veces como que se la saltan y creen que por ser doctores y estar en una posición de poder pueden discriminar y ofender a las mujeres. Pero por otro lado está la realidad de que como sociedad, nosotros que somos descendientes de inmigrantes, vivimos en una sociedad que constantemente nos vive violentando, marginalizando y haciéndonos creer que somos inferiores. Me encontré con que muchas de esas mujeres simplemente no decían nada frente a los niveles de violencia verbal o profesional que se ejercía contra ellas, porque en ese momento ellas estaban en una posición de desventaja. Ellas necesitaban un servicio que el doctor tenía que, o el doctor o doctora tenía que proveerle, y por más que el doctor le hablara feo o le dijera cualquier cosa mal dicha en ese momento, ellas sencillamente sentían o entendían que tenían que tragárselo, que tenían que quedarse tranquilas porque ellas necesitaban un servicio. Y en donde el trato es como, bueno, ellos no se posicionan en una posición de servicio, sino de favor y de superioridad, en donde yo tengo el poder y como tú necesitas mi servicio, tú tienes que soportar cualquier cosa que yo te diga. Ahora mismo con el tema de la pandemia, la mayoría de los servicios han estado paralizados en los hospitales públicos y nuestra población lógicamente es a estos centros que más asisten. Muchos de los hospitales simplemente han estado dando atención a cuestiones de servicios básicos, no servicios básicos, sino más bien servicios de emergencia, en donde mucha de la población que tiene necesidades de atención recurrente de diferentes tipos de servicios o programas no han podido obtenerlo, fruto de que prácticamente todos los servicios están paralizados y ahora es que estamos intentando volver a una nueva normalidad, pero que está siendo muy difícil. Si antes la atención para las mujeres negras y la población en sentido general era difícil, ahora con este fenómeno del COVID, todo se ha agudizado mucho más. Y bueno, yo quise como compartir un poco esto porque es una realidad que la vivimos no solo las mujeres negras dominicanas o las mujeres negras dominicanas de ascendencia haitiana. Cuando tú eres mujer inmigrante, que en este caso en República Dominicana son muchas, especial las que son de migrantes haitianas, pues este fenómeno se agudiza mucho más. Porque muchas mujeres inmigrantes que van a los hospitales muchas veces no saben hablar el idioma. Entonces, al no saber hablar el idioma, las compañeras con las que me contaban sus testimonios, ellas decían lo que les pasaba y podían expresarlo porque entendían todo. Pero cuando tú no eres del mismo país y tú no hablas el idioma, los doctores pueden decirte de todo y tú no lo vas a entender. Y eso es una realidad que sucede. Entonces ahí se falta mucho a todo el tema de la ética profesional. Yo me admiré mucho cuando la doctora, no sé cómo pronunciar su nombre, hablaba de su experiencia de diálogo y de conversación con las personas en el centro de salud donde ella trabaja. Que creo que en realidad debería ser así. A veces las personas van a los centros de salud no necesariamente por el padecimiento como tal, sino porque necesitan ser escuchadas, necesitan ser atendidas o necesitan ser valoradas como personas, que es una realidad que muchas veces nosotros no vivimos, no entendemos y el mismo afán de la asistencia del día a día, de la competitividad, hace que este servicio, que sea algo tan básico, se termine deshumanizando y terminemos nosotros deshumanizándonos como profesionales, pero también viendo a la persona no como un paciente, no como una persona, sino más bien como un cliente del cual hay que salir rápido para pasar al siguiente. Me dijeron que eran 5 minutos, creo que me extendí un poco, pero lo dejo abierto aquí para volver con cualquier pregunta. Gracias.
Gracias, Ana. Sí, the question, the issue of data, it's one of the most highly urgent issues for our communities, right? So if we don't have disaggregated data, then we as community, we know who are being impacted, but the data is not there. So it's very difficult to show to the state and to the government to say you need to focus on our communities because we are the one dying. And in Brazil now, the Black movements in Brazil have to fight a lot to have disaggregated data on cases of COVID because first the government was just taking the numbers. And then the movement starts saying we need it segregated by gender and we need it segregated by race. And after a lot of work from the movement, now we have it. But it's still not necessarily all clinics are doing. That is a whole issue, no? And it's very important to understand that you were talking about data, and in Brazil, I'm thinking about 2 cases, right? The first person that died in Brazil due to COVID was a Black woman, a domestic worker. The family that she used to work for, they went to Europe, they came back with the virus. They knew they had the virus. They told her to come to the house to work anyway. They told her to not worry. And now she's not with us anymore. The second case that I think about it when we think about COVID and Black women and our vulnerability in this pandemic is the case of Miguel Otávio and Mirtes, right? That is another Black woman, another domestic worker. The family told her to come to work. She came to work with the child because the child, 5-year-old boy, was not going to school because they were closed. So while she was walking the family's dog, the boy was alone. Nobody took care of the boy. The woman, the rich white woman that she used to work for, let the boy go alone on an elevator. And then the boy falls from there. So this is a conversation about gender, about class, about race. This is a conversation about reparations. This is a conversation about humanity. Because as Anna was saying, and I do have a lot of examples in my family about how arrogant are the doctors, how they don't even want to touch a Black poor person. When the touching and the examination is part of the diagnosis. You need to touch the patients if you want to know what they have. But if they don't touch it, and then if we think about this as a structural problem, right? Because I remember one of my aunts, I remember when she was so happy because one day she told me, oh, this doctor touched me. It was the first time in my life that this doctor touched me. And it was a Black doctor from Cuba. So these things are connected, right? We cannot separate that when we talk about health, when we talk about healthcare. We are talking about like a very deep level of dehumanization where these are very clear, and this is sometimes it is a matter of life and death to many people, especially poor Black people, right? So I want to say that, and I also we'll have a video question now. So would you like to play the video question? Then we go back to our discussion. So it's a video from an 11-year-old girl from Colombia.
Pues a mí lo que me parece, lo que yo creo de la cuarentena, pues es que pues simplemente es un obstáculo en el que solamente debemos saltarlo, porque el ser humano es más fuerte que una pandemia, más fuerte que cualquier cosa, porque el ser humano hemos llegado a hacer cosas muy hermosas y cosas que no son buenas, pero también las cosas hermosas deberíamos de reflexionarlas de las personas que hacen cosas buenas, no de las personas que hacen cosas malas. Deberíamos de aprender de las personas que en realidad se preocupan por nosotros, por la raza negra, que en realidad se preocupan porque en esta pandemia no nos ha tocado guerrearla. A los de las comunidades nos ha tocado guerrearla porque no solamente es como que estar en la casa y ya, pues también hay que comer, alimentarse, tomar agua y todo eso. Más que el presidente y todo eso no está dando apoyo. Debería dar apoyo a los que no tienen nada, a los que no tienen con qué alimentarse, los que no tienen con qué dormir, los que duermen en las calles. Debería ayudar a eso. No debería estar que solamente ser presidente no es solamente tener que estar en la presidencia y ya, no. Ser presidente tiene muchas responsabilidades, tiene como por ejemplo ayudar al pueblo, porque el pueblo no es como un juguete, no, el pueblo es algo que se respeta, el pueblo es algo que tiene que respetar. ¿Qué piensas sobre que, pues, cómo la he llevado en esta cuarentena? Pues muy bien. Pues he estado bien, aunque no fui a mi colegio. Es lo que más extraño, el colegio, porque pues, no puedo compartir con mis amigos ni nada de eso. Y tampoco pues puedo compartir con mis amigos de mi unidad. Y pues eso es lo que yo opino. Chao, gracias.
This adorable girl. I just want to say one thing. I want to say thank you, Paola, for she's translating our conversation on Facebook. So thank you so much. We see you. We appreciate you. And I want to open up here for Anna and Dr. Klagen to talk about what Jocelyn just mentioned.
Yeah, I like that. I think, when she said that, humans can do some really bad stuff too, yeah, it's true. And I think, at this time, just when I was listening to her, I thought about, the state of our mental health and so many emotions, that we are going through. And in fact, before I took over functions in July, my predecessor, Dennis Pures, worked a lot on issues of mental health. And about just living under the threat of violence, experiencing violence, surviving violence, and like sort of entering that cycle again over and over, and then dealing with the issues of being a young person, also trying to survive a pandemic. And often I'm thinking about how basically nowhere in the world do mental health get prioritized properly. Because even where there is access, it's usually in the private sector, where people still need money to afford. And just how much of COVID-19 will impact children, because I don't think many people are paying attention to the needs emotionally of children, to explain what's happening, the distance from their friends and the quarantining and the isolation and just the major disruption to their life. And it's so critical for children when they grow up, right, to have that certainty, to have that established routine. And yeah, I wonder what kind of mental problems we'll deal with in future because of COVID. And I wish for me there would be more support for mental health. And part of the work that I will continue to do is continue to shine a light on issues of mental health, issues of access, issues of compassionate, treatment, and issues of, institutionalization, and rather opting for community-led and community solutions and social protections that would lessen institutionalization and the need for it. So I'm just, I just looked at her, just how she looked, I just had that thought about, I wonder what's happening with other people, young like she is, and their mental health at this stage, as they not only try and navigate the usual puberty and teenage years and the turmoil and the turbulence, they now have to do all of that during a pandemic and still do schoolwork and not fall over, behind with their grades. So there's a lot that, young people are coping with. And like what she's saying, I think this is the time to show up in our fullness in terms of being kind and compassionate. Yeah, thanks.
Sí, bueno, me impactó mucho cuando ella decía que somos más fuertes que la pandemia y todo el llamado que ella le hacía incluso al presidente, de que bueno, tú eres un presidente, pero el presidente no está ahí nada más para presidir desde la silla, sino para resolver los problemas de todos y todas. Entonces, me parece muy poderoso esto que esta niña está diciendo, porque es parte de la misma realidad que también nosotros estamos viviendo acá en República Dominicana, mi país. Nos ha chocado mucho, creo que es uno de los países del Caribe que más ha estado impactado por este tema de la pandemia. La escuela ha estado cerrada desde marzo, cuando comenzó la cuarentena, y hasta el momento todavía los niños siguen sin ir a la escuela. Ahora en noviembre es que se va a abrir de nuevo las clases, pero será en una modalidad virtual. Yo tengo muchos sobrinos y sobrinas y veo cómo es la vida, cómo todo esto ha cambiado radicalmente sus vidas. Y me preocupa mucho todo el tema de la interacción. Cuando estos niños tengan que volver a interactuar con otros niños, ¿cómo será? Porque yo entiendo que van a estar perdiendo parte fundamental de lo que ha sido, de lo que es su niñez. O sea, este momento de la pandemia está rompiendo es como un año perdido para muchas personas en muchos sentidos, y especialmente para los niños y niñas, pero me preocupa mucho, por ejemplo, todo el tema de la exposición al digital que están teniendo mis sobrinos y sobrinas. Y cuando vuelvan a la normalidad, si es que volvemos a la normalidad, ¿cómo va a ser entonces esta desconexión de la virtualidad con la presencialidad? Me preocupa que los niños y niñas no están teniendo tiempo para jugar entre ellos, para divertirse entre ellos. Las personas, por ejemplo, ellos ahora están durante un mes en mi casa. Yo vivo en un apartamento, no tengo patio, no tengo espacio para que ellos salgan a jugar y divertirse. Entonces, todas estas cuestiones están impactando mucho su propio desarrollo. Y de tal forma que nosotros no nos estamos dando cuenta muchas veces. Los niños pueden ser que estén más agresivos y uno se diga, bueno, pero no entiendo por qué estos niños no eran así, ahora están más agresivos, pero eso es parte de todo el proceso que creo yo que están viviendo, ¿no? Yo no soy psicóloga, pero entiendo que todo este proceso está impactando de una forma que los adultos, como estamos con nuestros problemas, muchas veces no nos detenemos a ver cómo esto también está afectando la vida de los mismos niños y niñas. Y ellos también están esperando que suceda algo. Una de mis sobrinas me decía, por ejemplo, tía, cuando vuelva el nuevo mundo, cuando venga el nuevo mundo, yo quiero ir a la playa, playa, playa. Porque ella entiende que estamos viviendo un momento muy particular y vamos a venir, vamos a tener una nueva sociedad, un nuevo mundo. Y ella ya desea que venga ese nuevo mundo para hacer todas esas cosas que ella le gusta hacer, pero que ahora no puede hacer por este tema del COVID. Y yo entiendo que por lo menos, o sea, las autoridades tienen una responsabilidad muy grande. Yo creo que en mi país, de manera particular, hemos sido un poco creativos y responsables con respecto al tema de los niños en este momento tan particular. Acá se está pensando implementar la clase virtual. Vivimos en una sociedad que no está preparada para la virtualidad. ni siquiera a nivel universitario. Yo soy de la Universidad Autónoma de Santo Domingo, de la Universidad Pública, y en la universidad están teniendo muchos problemas para entrar a la dinámica de la virtualidad, porque era una modalidad que existía muy parcialmente. Imagínate ahora los niños que no están acostumbrados, madres y padres que no saben nada de tecnología, que los niños saben mucho más que ellos, cómo integrar todo esto a esta modalidad virtual. O sea, son preocupaciones que a mí, que no tengo hijos, que no soy madre, me preocupan porque soy tía y soy una tía muy responsable, que me involucro en la educación de mis sobrinos y sobrinas, pero que sé que es la misma realidad de todos los niños y niñas, especialmente aquellos que tienen menos acceso. Acá yo siempre digo algo, que nuestro problema en República Dominicana no es solo el acceso a la tecnología, sino también la calidad del acceso. Ustedes tuvieron problemas conmigo al principio por mi conexión, pero sepan que yo tengo el privilegio de tener este tipo de conexión. Hay gente que ni siquiera esto tiene, que es imposible invitarlas a un diálogo por Zoom, porque sencillamente la calidad de su internet no da ni siquiera para eso. O no da para asistir a un programa entero en Facebook o en cualquier medio. Entonces, ¿cómo vamos a implementar programas así con niños que son interactivos, que necesitan brincar, que necesitan bailar, que necesitan interactuar? Entonces, yo veo todo este panorama como con mucha preocupación y como un gran reto, aunque no estoy involucrada en todo el tema de la educación inicial o de educación temprana, mi enfoque más en educación con adultos, en formación, pero me preocupa mucho porque acompaño a niños y niñas también. Entonces, no sé si responde un poco a tus inquietudes, Ana, pero lo dejo acá. Gracias.
Gracias, gracias, Ana. A mí me gustó mucho cuando te estaba diciendo el pueblo no es un juguete. Like, yes. Como portuguesa. Porque eu vou ler um comentário de Nilza. Nilza, um grande beijo, uma honra ter você aqui, do Guela 10, uma das maiores, mais importantes organizações do Brasil. E ela disse: no Brasil, os impactos da pandemia não são iguais para todas, todas e todos. Mulheres negras e pobres, trabalhadoras informais, domésticas e as que estão na ponta dos serviços essenciais de saúde têm sua condição agravada, pois muitas vivem em moradias precarizadas em favelas e comunidades, sem água e esgoto e sem acesso à saúde pública e gratuita. I had to say that in Portuguese because that's very important. And Nilza, very important activist from Brazil, is joining us. So I wanted to say that in Portuguese. And thank you so much for your comments, Ana. And yes, I when I think about children, it's really also, yeah, it's a very complex situation. We have a question from Dominican Republic, and I'm going to read it now in English. So she said, I am interested to learn from South Africa and the right against apartheid. In Dominican Republic, the denationalization policy against Dominicans of Haitian descent is a way of racial segregation and apartheid, stateless, plus hate speech and violence. And hugs to Ana Maria, she said. So she would like to hear from the South Africa perspective of the apartheid and how the policy of segregation and hate speech and violence also influence. And this is Paola as well. Sorry.
Okay. Yeah, so this is a fascinating one because, you know, everyone understands sort of that protest in the streets. We remember all of the media coverage around Nelson Mandela, and many of us as Black women have been, you know, fighting the erasure and the importance of the work that Winnie Mandela did in the struggle. And it is part of her story and changing it from a history his story, and demanding that the voices of Black women, especially in the struggle, are respected and are not erased, because erasure is itself a form of violence. And when we talk about the health of Black women, when we talk about the issues just generally in life that affect us, of course, then our health, often we have other people speaking on our behalf as if we are not there, as if the lived experience itself is not enough for us to have a voice. And so it's important when we think about just even the struggle itself, to think about the process of the struggle and who we became to know and equate, right, to this democracy, and how much of that is in itself a patriarchal, misogynistic way of being. And I attended a lecture in medical school delivered by Professor Catherine Burns, and she was teaching about medical anthropology. And I had never heard, and in my young mind had not imagined how deep the racial inequality and the legislated racism had gone. I knew that there were health outcomes that were negative for me and my peers and my community, but I hadn't quite conceptualized it in the way that I did after that lecture. And I think that's why my activism around health is so important, because in South Africa, the apartheid government used the healthcare system as a tool to advance oppression, as a tool of violence, right? To a point where South Africa was kicked out of the International Planned Parenthood Federation globally because of the racist, misogynistic policies and the way that they were giving service delivery, right? And it's in our parliamentary records, it happened, and people don't quite know the history because it's her story. It's not his story. If it was his story, we would know about it, but it is her story, right? The injectables were being injected into her body, and misogyny, men bond over misogyny and patriarchy. And so they don't care that all of these things were done to the bodies of Black women, because as patriarchs themselves within the Black community, they don't see us as autonomous, right? They don't respect our reproductive rights. They think we owe the Black community procreation in perpetuity to prove, right, that we are in this together. And so our bodies and our uteruses, by extension, become part of the battle and become part of the politics and become part of what Black men need to prove to white men that they are men too. And that's how apartheid, and that's how the gendered issues, even during apartheid, remained. Because as Black women in South Africa, we are fighting the same battles around quality of care, dignified services, quality contraception options that we were fighting during apartheid. So when many of us say we feel unfree, we are yet to be free, people look and say, but what do you mean? It's because men will oppress us in apartheid, and men are oppressing us now still because of the gender-based violence, the femicide in this country, right? And so the freedom is yet to come for Black women in South Africa. But it started with the patriarchy. It starts with the hierarchy, right? And patriarchy and imperialism rewards domination, right? So there's this proximity to marginal power that men of all races think they have. And they want to enact that power, and they will only enact that power on people who they think are powerless, people who are in the margins. And those people are Black women, those people are children, those people are queer people, those people are undocumented migrants, those people are fellow Africans in South Africa. And so that's how the systems are connected. So misogyny is misogyny. I experience it the same way, regardless of what race the person is. And I think until we realize that we are not free, you know, in the name of, in the words of Audre Lorde, we're not free until all of us are free, right? And that's why that's important. So it doesn't matter what battle we are fighting. That's what my perspective and what living in South Africa has taught me about oppression, about domination, and about systems of power.
Yes, yes. Ana? Está el mudo ahí.
Sí, ahora sí. No, disculpen. Estaba hablando con el micrófono apagado. Sí, bueno, realmente, como dice Paola, la realidad de los dominicanos de ascendencia haitiana aquí es casi como una especie de apartheid, que se ha venido institucionalizando con las políticas racistas que se están implementando desde las estructuras de poder acá en el país, que básicamente acá, a diferencia de Sudáfrica, que como hablaba la doctora, se utilizó la medicina, se utilizó los doctores, acá se está utilizando el registro civil. La negación de inscripción desde el registro civil, la negación de derecho sobre la nacionalidad y la identidad para mantener a las personas segregada, apartada. Entonces, el Batey, por ejemplo, que es el lugar de las plantaciones de la caña de azúcar, se constituyó desde sus orígenes en un lugar aparte, prácticamente fuera de lo que ha sido la administración pública nacional. Un lugar que prácticamente se regía por las leyes de cada ingenio, de cada empresa azucarera. Y esto hizo que la población de los bateyes, más allá de reclamar derechos durante mucha época, más allá de reclamar derechos a las autoridades dominicanas, se las reclamaban directamente a las empresas responsables de los bateyes, y hasta cierto punto todavía al día de hoy muchas empresas fungen como si fueran las dueñas de los bateyes. Entonces, esto ha sido que se constituyera prácticamente como un territorio aparte dentro de la misma nación dominicana. Y eso es lo que ha dado pie a que el día de hoy tengamos todos los problemas que tenemos con la documentación, con nuestra identidad, porque el Estado dominicano ha querido desligarse de una responsabilidad que tiene con las comunidades bateyeras. Hoy en día ya no existe ya República Dominicana no es el referente del Caribe con respecto a la caña de azúcar como lo fue en el siglo XX y todavía a principios del siglo XXI, ya no lo es. Pero sin embargo, nosotros estamos sufriendo la causa o las consecuencias de todo este boom, y hoy en día ya no nos pueden apartar como lo hacían antes con respecto al enclave donde vivieron nuestros padres durante muchísimas décadas, pero se han encontrado con el tema de la documentación como un instrumento para poder obligarnos a permanecer apartados, alejados. Cuando tú no tienes documentos de identidad, tú sencillamente no puedes hacer nada. Mucha gente ni siquiera sale del batey porque sabe que por su color negro, por ser de tez negra, cuando salen a la ciudad, pueden encontrarse con un militar de agente de migración que le va a preguntar por los documentos, y si no tiene los documentos, es pasible de ser deportado a cualquiera de las fronteras dominico-haitianas. Entonces, esto hace que la población constantemente viva en una tensión, en una situación de tensión constante, porque no sabe qué puede pasar. Y eso se da tanto con jóvenes como con adultos, tanto con mujeres como con hombres, o sea, es indiscriminadamente. Pero se da mucho más, o sea, tú vives esta mayor tensión cuando tú eres una persona que evidentemente no tienes este documento de identidad. Y esto al final va haciendo que tú mismo muchas veces te auto excluya o te autolimites o restrinja tu propia movilidad, cosa que está en contra de las leyes y de la misma Constitución. Todos tenemos derecho a la libertad de tránsito y esto es algo que aquí no se da de manera efectiva porque las autoridades te lo impiden. Y por ejemplo, que es un caso que no es solo con los dominicanos de ascendencia haitiana, sino con la población en sentido general, cuando hablamos del perfil sospechoso de los agentes policiales. Los agentes policiales categorizan a las personas con un perfil sospechoso, pero ¿qué es ser o qué es tener un perfil sospechoso? Ser joven, negro, mal vestido. O sea, esos son los perfiles, porque si tú eres blanquito y anda mal vestido, tú no tienes un perfil sospechoso, pero si tú eres un negro, si eres joven y anda mal vestido, automáticamente para las autoridades tú tienes un perfil sospechoso. Y para esta sociedad que valora tanto la apariencia, los negros dominicanos de ascendencia haitiana o los inmigrantes suelen tener más este perfil sospechoso. Entonces, es como una realidad que de manera directa o indirecta, las mismas autoridades o la misma sociedad nos va empujando y en otros casos lo van haciendo de manera más directa, como es el tema de la documentación, como es el tema de los estudios, o sea, todo el tema, a pesar de que aquí el estudio básico es gratuito, universal, reconocida por la Constitución, las madres y los padres de los niños sufren mucho cuando no tienen los documentos necesarios porque en las escuelas les impiden el acceso. Ahora mismo con este tema del COVID y de la virtualidad, yo me he quedado pensando mucho en qué va a pasar con los niños y niñas que son de hijos inmigrantes o de padres haitianos y dominicanos y que no tienen documentación. ¿Cómo será su acceso? Por ejemplo, el Estado dice que le va a dar computadora o tablet para que puedan acceder a la educación virtual, pero realmente esto, ¿cómo va a ser? ¿Será democrático, universal realmente para todos los niños? Son inquietudes que uno tiene, que no tenemos respuesta todavía, pero que uno se la va haciendo porque este sistema no es, decimos que somos un sistema democrático, pero no lo es. Aquí se puede hablar de una falsa igualdad racial, que realmente tampoco lo es, porque no todos somos iguales, no todos tenemos los mismos derechos, aunque la Constitución lo diga y las autoridades lo repitan. Pero en la práctica, el ser de un batey, el ser negro, el ser de ascendencia haitiana, te coloca en posiciones diferenciadas del resto de la población dominicana. Entonces, no tenemos tal igualdad que se promulga tanto ante las leyes.
Sí, gracias, Ana. Sí, yo estoy pensando aquí, escuchando a ti. Sorry. I think that the interpreters will get a little crazy because I speak Spanish and then English and then Portuguese. Sorry. Perdão. English. And I'm thinking here about what you were saying about the suspect. And I'm trying to do the connection with Brazil too, and how sometimes if you are young, a Black person, but you have nice clothes, you can be even more suspect because the police would be like, but how do you have money to buy these clothes? It's because you are involved with something illegal. So there is no way to go. You know, it's really about the criminalization and the control of the body that moves, right? It's about the movement. It's about where we go and where are places which places we can go, which places we cannot go. Sí, Ana.
Hay algo que yo quisiera agregar aquí en este tema del perfil y tiene que ver también con el tema del obstétrico y la mujer negra. Acá hay unos grupos ultranacionalistas que tienen campaña fuerte contra los haitianos en todos los sentidos. Contra mí, bueno, ni hablar. Pero con respecto al tema de los obstétricos, las mujeres negras, aquí, por ejemplo, se acusa mucho a las haitianas de venir a República Dominicana a parir. que incluso dicen que hacen tour para venir simplemente a parir, como en Haití el sistema de salud es mucho más ineficiente que en la República Dominicana, pues no sé qué tan cierto o qué tan incierto sea, pero muchos de los discursos para fomentar la discriminación y el odio racial es acusar a que las haitianas vienen a la República Dominicana a parir, así desplazan o que le quitan el espacio a los dominicanos, que no hay suficiente asistencia para la población dominicana porque la población haitiana consume todo el tema de la asistencia. Entonces, hubo una ocasión en donde se hicieron varios reportes periodísticos donde iban a las maternidades y hacían reportaje con fotografía, con imágenes, diciendo, mira la cantidad de mujeres haitianas que hay, por cada 5 camas, 4 están ocupadas por haitianas y solo una dominicana. O en los hospitales, por ejemplo, a veces las mujeres cuando paren, los hospitales no tienen suficiente espacio y 2 niños tienen o 2 madres tienen que ocupar una misma cama maternal porque no hay espacio suficiente. Entonces, a veces los medios de comunicación, en vez de hacer la crítica sobre la ineficiencia o la deficiencia de nuestro sistema de salud, lo que hace es echar la culpa a la población migrante o a la población negra haitiana de ser los que vienen a acabar con los recursos de salud y que se deja de atender a la población dominicana para atender a la población haitiana. Y en uno de estos reportajes, ellos hicieron con fotos de varias mujeres y una compañera dominicana que también es periodista, ella pudo identificar y rastrear a varias de estas personas que ellos habían puesto en el reportaje diciendo que son haitianas que vinieron a la República Dominicana a parir, y ella pudo demostrar que no se trataba de una haitiana, que se trataba de una dominicana que incluso es profesora de una escuela pública en una comunidad muy específica y ella pudo dar su nombre de manera específica. Entonces, aquí yo traigo esto a colación para hablar cómo muchas personas, no solo policías, sino también periodistas o hacedores de opinión, simplemente porque tú eres negra, porque tú pareces de tal o X nacionalidad, ya te indagan el hecho de ser haitiana y así discriminar o denigrar a toda una raza o a toda una sociedad, a toda una población, cuando realmente no lo es. O sea, yo voy en la calle y mucha gente, bueno, tal vez a mí ya me conocen, ya saben, pero tú como negra o no, tú puedes ir por la calle y ya la persona, por tu forma de andar, por tu forma de vestir, ya ellos determinan si tú eres o no haitiana. Y muchas veces tú no lo eres, tú eres negro, porque este país es un país de negros y negras en su mayoría. Sin embargo, aquí pareciera que todo el negro es haitiano. Y por eso incluso nosotros hemos tenido experiencia de personas extranjeras que no son haitianas, que son negras, que han sufrido de discriminación en este país porque lo han confundido con haitiano. Entonces, como que quería simplemente traer a colación esta experiencia de cómo el perfil de la persona, de cómo nosotros muchas veces nos confundimos y discriminamos simplemente a cualquier negro porque nos han enseñado históricamente a rechazar al negro porque es semejante a ser haitiano.
Sí, sí, gracias. Gracias, Ana. We are finishing our session here. Would you like to finish with Anna's words? And I also would like to add here the words of Jocelyn, that the people are not a toy. And this really got with me. Would you like to pass to Mahi to talk a little bit about our next sessions for a few minutes, and then we're going to do the closing. Mahi, please.
Hi, everyone. Okay, so we have, I don't know if you can see me or if you're seeing me, Anna. Okay. So we have 2 more events, in this webinar series of Entre Fronteras. The link to register in the webinars are in the chat, and I also posted that on Facebook. So if you're watching us via Facebook, you can register to the one that is November 12th, is Black Migration in the Americas, an Invisible Issue. And November 19, Housing Rights as Essential to Racial and Gender Justice. So please register to the other two webinars. The link is available in the chat and the Facebook as well. Anna, you want me to talk about the fund? Okay. Last week, Afroresistance also launched the Black Latina Girls and Women Fund. This fund is a fund where we give money directly to Black women and girls in the Americas, in the region, United States, Latin America, and the Caribbean, who are experiencing severe financial needs, especially due to COVID-19. So I'm sharing here now in the chat as well in the Facebook, the link to the fund. The first round of applications is now open. So please spread the word, share with your network. And we are also accepting donations as well, because we are opening different rounds of application according to the donation that we get. So we reached our first goal of $10,000, and we are opening this first round of applications for Black women and girls who are in the region. You can find more information on the website as well as the form for applications. And if you have any questions or comments about the fund, you can write to me for Mahy, M-A-R-R-Y, at afroresistance.org. Thank you, Anna.
Thank you, Mahy. Thank you, everyone, for joining us for this such important conversation. It's really touched my heart. I really thank you, the Special Rapporteur, Dr. Teiling, Anna, once again, my friend, thank you so much. Thank you, the interpreters. Thank you, Priscilla. Thank you, Ali. Thank you, Lamar. Thank you, Raquel, for organizing this as well. I also would like to thank the UN Office for Human Rights and the International Decade for People of African Descent for helping us to put these events together. It's really an honor to have you all here. And I see you on the next event. And I share to everybody. Thank you so much. Você não